Service has always been a really important part of my life, and since I graduated nursing school a couple years ago, I started volunteering as an RN and also as a resource assistant at Madelyn Free Clinic in Salt Lake. And the patients we see at the clinic are very well below the federal poverty line and completely uninsured, so they would have no other access to good health care without us. And everyone that works there is completely volunteer based, and they only have a few full-time staff, so the nurses and the physicians are all completely service. So when I started volunteering there, this is when I really started to fall in love with family practice and primary care. For the first time, I was working along physicians that were educating patients about hypertension and diabetes and kind of everyday ailments that these patients were going through. And that really motivated me to become a nurse practitioner so I can increase my capacity to take care of patients in a way more than I do just right now as a nurse. I would say my career has been very influenced by the patients I take care of, and whether in the ICU with my full-time job or with my volunteer work at Madelyn Free Clinic. I was taking care of a STEMI patient the other day, and he had an MI and we had placed a couple stents, and I was taking care of him on his day of discharge. He was a truck driver from Wyoming, and I had the pleasure of doing his discharge education for him and teaching him about how to keep this new stent healthy and patent, and the importance of taking these medications every day, and things you can do to prevent these kind of major life events from happening again in the future. And moments like this help teach myself actually how much I really love the education and preventative care part of my job, and that has really influenced me to look to this DNP degree. And also with Madelyn Clinic, that's when I kind of started to realize what a big problem we have with people that can't afford health care, and what a burden that is for them and also for our community as well. And I look forward to the DNP just because it prepares me to be more of a leader and more aware of public policy and healthcare specifically, and healthcare economics and things like that. So family nurse practitioners are similar to physician's assistants when you describe the exact role that they do. However, they are a more autonomous provider. They can prescribe and diagnose and also see their own patients, unlike a PA who has to have a physician sign off on their diagnosis and medication. And similar to a physician, they can see their own patients, run their own practice. FNPs, they usually are found in a family practice clinic. They can see patients from pediatrics all the way up to geriatrics. They do comprehensive care for these people. They also coordinate between specialty physicians and also do referrals for other patients in case they need to see someone out of their scope of practice. Nurse practitioners are heavily focusing on educating their patients, such as immunizations, things about preventive medicine, big emphasis on holistic care. And this degree used to be a master's degree, and they are now pushing most master's educated nurse practitioners to go for their doctorate degree. And the DNP, or doctorate prepared nurse practitioner, has a very unique role. They not only can provide fantastic direct patient care, but that doctorate level also gives them the ability to have a little bit more of leadership roles and kind of step above just that regular patient to physician care that they were doing in the past. They're very well versed in like healthcare economics, public policy, more about our economic system and how healthcare plays a big part in that. Also with healthcare finances, they're also awesome with research and evidence-based practice. And so the doctorate level is a terminal degree, and that's kind of just the step up from just a master's level prepared NP. And the thing that I'm really drawn to in the DNP is the leadership position and the ability they have to create change and move our healthcare system into more of a better space than it is now. And I really learned that at Madelyn Free Clinic, and I've seen these uninsured people that would not receive healthcare without free clinics like Madelyn. And I want to create more great resources for people in our communities so that they can receive great care. And that's one of my professional goals I've always had, is to help people find care and live healthier lives. And I think that the DNP program is a perfect fit for me for that reason.